Okay, hi, this is Paul Sakis, Good News Planet and Good News Broadcast and Peace, World Peace Day. And I'm saying that because we're going to talk about a serious subject. We're going to learn about diet for diabetic patients to control debilitating pain. And anybody who is either on the border of diabetes and or has diabetes, I think they say like 1 out of 10 here in America have pain, and it's a concerning pain and life concerning. But we have with us, and we have a new invention. We have good news to actually share with you all. That's I'm so happy to get the opportunity to do that. So we have Dr. Silky Patel. Hi, Dr. Patel. How are you?
Good morning. How are you?
Okay, you're an interventional spine, sports, and pain management physician. You're in Houston, and we have a very brave woman, and I will say, Ms. Farah Stewart. Hi, Farah. How are you?
I'm great. How are you?
Okay, and you're a patient of Dr. Patel's, and well, something you put in your back, and then you put it in your back, it makes your leg better, or it makes your body better. What are we talking about here? This is our future. We're doing better every day.
Yeah. So what we're talking about is spinal cord stimulation, otherwise known as SCS.
Okay, and tell us.
And spinal cord stimulation, yeah, as you mentioned, it is a small battery-powered device that lives in your back, underneath your skin, and it blocks pain signals going from your spinal cord to your brain. The best thing about it is that patients can try it before they get it. So I explain it as it's like test driving a car.
Okay,
And the
so
best thing about it, there's been some studies on it, and they've been shown that patients who get SCS as opposed to medication management alone, they actually get 17 times more significant pain relief than when treating DPN or diabetic peripheral neuropathy with conservative measures alone.
uh-huh. When you showed that, we just showed an image here where it will go into the back and so on and so forth. And I see that the person has a great build, is looking quite healthy. Diabetes
Yeah.
doesn't care. Well, it does care, right, about different factors, obesity and so on and so forth. But you can also be quite thin and get diabetes. Is that true?
Oh, yes. So DPN or diabetic peripheral neuropathy actually affects 3 in 10 patients who have diabetes. It feels like numbness or tingling that begins in your toes, progressively goes up to your feet and up to your legs. What happens in diabetes is that blood sugar levels remain high. So eventually they affect your nerves. And you're right, it's prevalent in, I guess, older patients, and not just younger patients. It actually affects older patients more, those that are prone to cardiovascular and peripheral vascular disease.
Uh-huh. Okay, Farah, very brave Farah coming out here and talking about your own scenario. So how did you first learn that you had diabetes?
I was diagnosed with diabetes in 2018, and around the same time I started having symptoms of diabetic peripheral neuropathy. I'm very familiar with diabetes. I'm a registered nurse, and my mother, and we have a very strong family history. My mother has diabetes and she suffers from diabetic peripheral neuropathy, and I knew what to look out for. And the symptoms, as Dr. Patel stated, started out exactly as she said: pain and numbness and tingling in my toes that went into my feet and eventually up my leg. And it becomes where it's life altering. I wasn't able to do the things that I would do on a regular basis. I couldn't attend events where I had to stand for long periods of time. I couldn't wash dishes, go to things with my children, and eventually I had to stop working. The pain and the debilitating pain and the disability became so difficult to manage.
Were you trying different medicines to control your diabetes? I believe, I don't know
Yes,
whether they were out and they weren't working for
yes.
you.
The medications were controlling my blood sugar, but the damage with the diabetic peripheral neuropathy to the nerves had gotten to the point where the medications that Dr. Patel prescribed weren't helping. The compression stockings, the physical therapy, I was not getting enough pain relief where I could live life normally.
Uh-huh. So, Dr. Patel, is that fairly common? In other words, when you get diabetes, because I'm on the border, myself. Okay, and I even have some nerve pain in my foot, and I've been tested different kinds of things, neuropathy. Pain specialists, they tried to pick me with little pin things and all kinds of things to check me out. But I'm very concerned about if I go over the what 7 points or stuff like that. Is that when it happens that you literally have diabetes?
So actually, so there's no cure for diabetic peripheral neuropathy. However, when a patient's referred to me, as Farah mentioned, I really like to try the conservative measures. And as you stated, it's not really just about when you get full-blown diabetes. Even if you're pre-diabetic, yes, when you're pre-diabetic, you can have symptoms of diabetic peripheral neuropathy. So when patients are referred to me for diabetic peripheral neuropathy, I try the conservative measures like compression stockings, physical therapy, some of the oral medications called gabapentin, pregabalin. And when those things don't work, I take it to the next step and really try spinal cord stimulation, otherwise known as SCS. And actually, the reason we're here today is because Medtronic got FDA approval for spinal cord stimulation to be able to treat DPN. So thankfully to them, we have other options, because even though diabetic peripheral neuropathy is not curable, it is very manageable.
So I was just going to say, and Medtronics is a great company. It's spent billions of dollars on research, and obviously they've come up with something here. So is this actually a new FDA approved? I mean, like within the year?
So spinal cord stimulation has been around a long time. It had other indications for, failed back surgery syndrome, lumbar radiculopathy. However, they put a lot of time and effort into getting it FDA approved specifically for diabetic peripheral neuropathy. And mentioning one more study, we actually see that patients followed 5 years out are still getting significant pain relief.
Oh, this is great news, and now, well, we'll get it to our community, but more. What types of doctors need to know about this?
So, interventional pain physicians are a type of doctor that can take patients through that whole journey, from the conservative measures all the way to being able to considering spinal cord stimulation. So what I always tell my patients is, don't give up hope. Even though it's not curable, we want them to be able to live the best life possible. So don't give up hope. Find the appropriate healthcare provider. Visit a website called dpnrelief.com, which is a great resource. And from there, they can learn more about it and find a trusted healthcare provider that can be with them really through that whole journey.
Great. And Farah, you didn't give up hope, right?
I did not.
You kept on going, and you met
I did.
Dr. Patel, and you're feeling okay now.
Yes. So Dr. Patel suggested the Medtronic Intellis spinal cord stimulator. I did a trial for about 5 days. And the trial is where you wear the device externally, you go home, you try to do as many regular, normal activities as possible and see how you feel. And I had a big decrease in pain during that trial period. So we were able to move on to me getting the permanent implant. And it's been working great since. It's made a tremendous difference in me being able to function daily. Complete tasks that I was doing before and unable to do. I've been traveling, and it's just made a big difference in life and in pain relief.
In your pain relief, because I have plantar fasciitis, I'm a good example for a lot of my interviews because we get a lot of these things. Do you have more pain like lying down or when you get like out of bed in the morning? Is there a certain time that you get more pain?
I had pain all the time, yes, the mornings and night were the worst.
Okay, and that's common, Dr. Patel?
Yes, diabetic peripheral neuropathy, actually, a lot of my patients do say that at night, even the sheets touching them, it causes pain in their feet, the numbness, tingling, and it really has given them problems sleeping. So a lot of my patients, after I do the spinal cord stimulator trial, during that trial period, they even tell me, oh, I slept better. And that's a huge indicator of good pain relief.
Success. There you go. All right, give us the websites that people can go to one more time, if you wouldn't mind, please.
Yes, it's called dpnrelief.com. Thank you so much.
Thank you.
And thank you both. Thank you. And thank you for coming out and speaking about it. Thank you.
Thank you.
Thanks for having us.
Okay. Go Houston.